Good evening and welcome to CSIS. I'm Steve Morrison. I'm the Senior VP here at CSIS, and I run the Global Health Policy Center. And we're really thrilled this evening to welcome Debbie Birx here to CSIS in conjunction with the Global Health Council and with its leader, Christine Tsao, to really celebrate the beginning of Deborah's tenure and her leadership team, and to hear more from her in a facilitated discussion that Christine's going to hold here about what PEPFAR will be undertaking under Dr. Birx's leadership. I went back last night and read over the presentation that Deborah made in Melbourne, which to my mind was a sort of monumental moment in understanding what she meant in saying that we need to be doing the right things in the right place at the right time, and unpacking what that meant, and unpacking how important that was in order to understand the impulse and the imperative at changing the epidemic, controlling the epidemic, and moving very systematically through this period. And at the Melbourne gathering, I think that presentation was exceedingly well received, and it was reinforced and resonated throughout the conference from the multitude of other actors who came forward and said things that were quite supportive and consistent with that outlook. And that included the leadership from the International AIDS Society itself, from South Africa, from UNAIDS, from the Global Fund. There is a consensus, a broad consensus around these ideas that is forming, and I think it's the leadership that has come from PEPFAR and come from Deborah in her tenure at CDC and the other key roles that she's played, and now as Ambassador at Large in running our PEPFAR program, fully able to carry that forward. So thank you for coming today to be with us. Thank you to everyone here who has chosen to join us for this important session, and thank you to Christine and to the Global Health Council in agreeing and coming to us with this proposition. I think it's very timely. We've welcomed the chance to do this as a member of the Council, and we've been very encouraged to see all the gains that the Council has made in this last period in reinventing itself under Christine's leadership. Okay. Thank you very much.
It's my pleasure to be here today and to welcome you here today. Steve has very kindly set the scene for today's discussion. I'm so pleased from Global Health Council's perspective that we were able to partner with CSIS on this event today. It's something that we actually talked to Ambassador Birx about just after she had come on board, and with all of the busy activities over the summer, as you can imagine, we needed to find a window of time that would work for all of us, but it was something that we very much wanted to do. And so, Ambassador Birx, thank you very much for being here today. The program today is actually quite succinct. We are going to hear a little bit from Ambassador Birx, and I have asked her to speak specifically, if she could, to a bit about the programming of PEPFAR and how PEPFAR is working with supporting integrated approaches to global health. I think we've seen some really wonderful collaborations, especially around family planning. But as you know, the Global Health Council community is made up of a wide diversity of global health actors, really working on all aspects of global health writ large. And in particular, I think that what I've seen since I joined GHC at the end of 2013 is that there's great interest in how we can use some of the platforms and real inroads that PEPFAR has supported to also help with advancements across MNCH, reproductive health, certainly family planning as already has been done, and also looking at non-communicable diseases. And I know we've been spending quite a bit of time talking about how the intersection between HIV and NCDs can really provide a great starting point or continuation for being able to increase attention and capacity building efforts and interventions around NCDs as well. So that is a very broad global health landscape for a very large portfolio that you already are so competently and energetically overseeing. But I think that just kind of sets the stage for what we were hoping to hear from you today. After Ambassador Birx's remarks, we will have time for some questions and answers, so we definitely wanted to make this an interactive event. And then, of course, at the end, we have a reception out in the beautiful atrium, and so we will have a chance to continue the conversation out there. So, Ambassador Birx, with that as the landscape you've walked into here, maybe I could ask you for your thoughts on that.
Great, thank you, and thank you all for coming, and Steve, thank you for the introduction and this fabulous CSIS space, and for your long-term work that CSIS has done throughout this pandemic. I got to know CSIS when I was in the Department of Defense, and they were the first group that really worked with us about the problem in the African militaries and raising it as an issue of readiness and competencies with the militaries about the number of HIV infections. And so a lot of the focus early on was the HIV militaries, and that was 20 years ago. So it really, first group really emphasizing the issues about global health and its importance. And thank you, Christine, for the Global Health Council continuing on and strengthening, and for all of you who bring your wisdom every day. I was very fortunate before I took the position is a lot of people had written advice to the new Global AIDS Coordinator, and we had several months between nomination and confirmation to really work on those things and create a real algorithm of where we were having really large gaps and what everyone wanted to see from us, hear from us, and be part of, and incredibly helpful suggestions. So one of the suggestions that ran through every single comment was transparency and access to data. So one of our key platforms is to make all the PEPFAR data available to everyone. And so if you go to the website and you go to the data column, you can see all of our results since the beginning of PEPFAR and all of our budgets. We're working right now in getting information about gender on all of our documents, and then really expenditures, because in the end, you don't want to know what was budgeted to the countries, you want to know actually what was expended. We also are committed to put our quality data up on the sites, as well as all of our impact data. So we really are very serious about a transparency agenda, and for you all holding us accountable for our work that we're doing in the pandemic. We think it's very important that all can see the work that the United States government is doing and how it's being translated into life-saving programs. You all know that data. I mean, you know the number of people we're reaching with treatment, nearly 6.7 million. Last year, we tested nearly 60 million people. 60 million people tested in the HIV program, of which about 13 or 14 million were pregnant women. So we're incredibly excited about the depth and breadth of the program and awed by it. To think that you've done 60 million rapid tests for HIV is a little concerning when you think of all the things that could possibly go wrong. And for those of us who came out of bench work and laboratory work, you're always convinced that you have to find the last problem. So when you have that volume of work, we're really working on the systems with governments now to ensure that everything, the systems are there to look at the quality of the program in all of the different areas. But I think today you really wanted to talk about some of those intersections and where PEPFAR has really worked to both strengthen health systems as well as integrate with programming. So I'll start from the most recent piece and move backwards. So the most recent piece, and the thing that I think will have some of the biggest impact on integration is countries moving to B+. That is offering comprehensive treatment for the mother, both through pregnancy, through breastfeeding, and then for her own health, continuing on. This has allowed us to translate all of the care and treatment down to the primary health center and the MCH blocks, working primarily within the African maternal health child blocks and how health care is delivered to pregnant women and children under 5. That presence is really allowing us to do much more integrated work for both under 5 survival and working closely with Administrator Shaw, as well as maternal health during pregnancy. Working backwards from that, we launched Saving Mothers, Giving Life, which was really an important piece of PEPFAR because it looked beyond the immediacy of HIV. We know that HIV pregnant women have a higher mortality in general. They have higher risk pregnancies, more complications, more risk of infections, and more risk to the baby. But this was really a comprehensive program to look at what could be done in a manner to ensure in that 24, 48-hour period of labor and delivery to ensure a healthy mom and a healthy baby. And it had very exciting results. Almost a 50% decrease in maternal mortality, which is extraordinarily exciting. But when you look at that composite of the program and you look at the B+ rollout, and then you say, well, what is the gap there? Because there's still a fundamental gap, and we realized we had to do more for children. And so we really were excited about the partnership with CIF, which was announced during the African Summit, to double the number of children that are accessing life-saving ART. And again, that will be a translation of work down to the maternal child health blocks, where we can reach in a comprehensive way the mothers and the babies affected by HIV. So moving backwards yet again, you will know that PEPFAR has worked very hard within the health system, supply chain management and improving supply chain management and improving that all the way down to the level of the health center and tracking that. We're excited about, when I came into the position, we talked with each of the agencies of, well, we know where all the gaps are, what can you do more? What do you feel like you could bring to PEPFAR but are not being utilized for right now? We just finished a meeting with all of our principals this morning, and USAID came forward with innovative health financing and really working with countries on improving host country investment in health writ large and in HIV specifically. CDC came forward with an agenda to really look at impact and the impact of these programs and doing comprehensive surveys with incidence and prevalence to really look at all of the cascades of our programming. So at the community level, are the people who are on ART virally suppressed? Are children receiving treatment? Who has been tested? What are the gaps? And everybody who is identified as new positive immediately has both viral load and CD4 cells done. So we know exactly where the entire country is within the pandemic. So we're excited about that piece too. But Peace Corps came forward saying we want to help document the supply chain at the level of the health centers and the district hospitals where our volunteers work. It will be helpful to the community to go in and look for the essential medicines. And by text, send back and say, all 20 essential medicines are there or not. Everything can be coded, and it can be simply said, number 3 and number 6 are missing. But because they're in the communities, they can go back not once, just on a site visit, but they can be there continuously looking for the arrival of those essential medicines that will give us real-time feedback about whether the items that we think are there and that we thought were delivered there are actually there and available at all times. And I think that kind of integration and using the core strengths of each of the U.S. government agencies make it a very exciting time for PEPFAR. We've achieved an amazing amount, and certainly certain countries are already developing what we believe is control of the pandemic. But we have half of the countries with the devastating disease where it doesn't look like they're developing control. And certainly if the pandemic continues to be out of control in those countries, we know that there are not enough global resources to pay for an expanded epidemic. So we have this moment in time where we think between Global Fund and host countries and PEPFAR and other bilateral donors, we can wicker together a comprehensive response that we call the right things in the right place at the right time, which sounds simple, but actually not everybody is focused in the right place at the right time with the right things. And we're finding evidence of that, because when you go out and you look across all of the countries, it's not all equal. So when you go to South Africa and you talk to Precious, she'll tell you that the epidemic is in 13 out of the 52 districts. That's where the epidemic is, that's where it's expanding. Yes, there's HIV and AIDS in all the other districts, but it's expanding in those 13. And working with countries at a subnational level to really focus in the right place can bring us to the end of this epidemic together. And so that's why we're very excited about this data use. I think PEPFAR has worked very closely on a comprehensive health systems approach that's brought laboratory quality across sub-Saharan Africa. I tell you, to many of us who have been with PEPFAR and been in global health for 30, 40 years, it's a little bit devastating to see what's happening with Ebola, because those are 3 countries that PEPFAR never went to. Ebola in DRC and Uganda repetitively over the last decade has been controlled within days. Yet in these countries, it's not. And it really, it just shows you that the partnership that you all bring and that PEPFAR dollars brings is so critical to have people on the ground working side by side with NGOs, ministers of health, in both the public and private sector. And then you wanted to talk a bit about NCDs. Let me just mention where PEPFAR has worked in that area. So we've worked in the health system to strengthen overall health systems. We've moved the availability of the services down to where the community is through community programs with B+, which we think will actually have a great impact on child survival as well as maternal mortality. But we've also worked in what we call Pink Ribbon, Red Ribbon campaign, and that was a partnership between, and is a partnership between the Bush Institute, UNAIDS, and a series of, and the Coleman Foundation to link breast cancer, cervical cancer, and HIV/AIDS together, realizing that young women are a particularly high risk for an aggressive type of cervical cancer if they're HIV positive. And so HIV positive young women who get HPV have a more aggressive form of cervical cancer. And it was felt that we have saved women by giving them life-saving ART, and yet they die from cervical cancer, which remains one of the highest cancer risk rates for women in sub-Saharan Africa. And so we knew that we couldn't do that alone because we were working on HIV, and although we could link it to HIV positive women, we obviously didn't want to limit the interventions to HIV positive women. So through the Bush Institute, we're able to bring private sector partners and other partners to the table to leverage the PEPFAR resources to allow screening now being taken to scale in Zambia, Tanzania, and Botswana, matched with Gavi and HPV vaccines. So it's an exciting time to be able to create those broader partnerships that bring that complete health agenda in a way that we couldn't do it alone, but we can do it with partnerships. Those partnerships have really highlighted the importance, and still the importance, of in-country leadership. The countries that have had success in controlling the pandemic have had dynamic and focused leaders in countries that emphasize the need for comprehensive programming. The same thing with cervical and breast cancer. Many First Ladies have stood up and really championed this cause, and it's really helped us advance it more quickly. So I know that's a bit of a tour of PEPFAR as it intersects with maternal child health, family planning, and the importance of family planning at the level of the maternal child health blocks, the Pink Ribbon, Red Ribbon campaign, and the health system pieces that we've been privileged to work on with our partnerships with countries. But I really want to hear from you all, because I'll learn from your questions how to do my job better. So I'll stop there and ask you to open it to questions so I can hear from the audience.
Certainly, thank you so much, and I think that was a masterful tour. I want to thank you so much, and I'll just note, I mean, I took away, I think, 4 major themes that I pulled from your responses today and from what you've said, which I think are just so relevant to everything you've been talking about, which is has PEPFAR at its core, but also stretch across all that we're trying to promote in global health. The first being really the importance of partnership, and you've talked so well about partnership across sectors of intervention as well as sectors of different partners. So for private corporations, foundations, INGOs, et cetera. So that being one key theme. A second is just this idea of the life spectrum. And so, we're dealing with prevention of mother-to-child transmission, but we're also dealing with people who have been living with HIV for 30 and 40 years. And how can we really recognize all of the needs for people throughout their lives, whether it's a new infection or whether it's an infection that is now a chronic condition and really means that they need a particular kind of care. And that then translates for us in other areas to what it means to be going from talking about under 5 survival all the way into NCDs at whatever point they occur during the life cycle. I hope I can come up with my 4. I've got 2.
I think you're doing great.
I had them all together.
Maybe you want to talk about
talking.
how the World Health Organization should be reformed.
No, I think I'll throw that one out back to the audience. I know this third one was disaggregation, and whether it's disaggregation of data, but also disaggregation of analysis and disaggregation of intervention. And again, thinking about just when we look at MDGs 4 and 5 and how far we've come in the last 5 to 10 years, thinking about, we're meeting our targets too. Well, in fact, there are a lot of people being left behind because we weren't looking at what was happening where. And seeing the same approach in HIV and AIDS and how important that is. And this idea that we have data transparency and accessible data. And I did start out as a data wonk, and so I really do share that enthusiasm, and I think that's just such an important message, and especially coming up with those tools and resources that anybody can access, and people and governments and national partners and local partners can access and use for their purposes as well. And there was a 4th, but I'm sure it'll come to me over a glass of wine in the atrium. Yeah. But in any case, I really want to thank you. I've enjoyed the other occasions that I've had to hear you speak since you came on board. I always learn something new. I think I can speak for our whole community in saying that we're all looking forward to working with you, and we really see just a wide possibility of collaboration, and that we are all going towards the same post-2015 landscape. And so being able to navigate that journey together is going to be so much more impactful and effective doing it in partnership than doing it alone. So
great.
Thank you. Thanks again to Steve.
Use our data. Go to the website. Use our data. Send us questions. Send us your insights. They're amazingly helpful to us. Amazingly.
And thank you.